Not gonna lie, right here looks crazy though. I'm not gonna lie, bro, like a monster. Lord.
So that x-ray that Rakai is looking at is called a lateral ceph. As orthodontists, we use those x-rays as a diagnostic tool to tell us the position of your jaws, the inclination of your teeth, your growth status, a bunch of different things. So we can look at that x-ray to tell if your upper or lower jaw is too far back or too far forward, if your teeth are pushed out too much, like if they're very proclined or retroclined, like pushed back. And we use that to develop a treatment plan in orthodontics. See, before I got to residency, I used to think it was as simple as put braces on, make teeth straight, take braces off. But then I started learning about more intricate things like extractions for treatment, headgear, growth modification, things like that. So in Rakai's Ceph, you see a bunch of different things that would help develop a treatment plan. Number one, he's low-key bimax protrusive, like both of his jaws are pushed a little forward. And you can kind of tell, like if you watch his videos or his streams, you see his face and his facial profile, like his lips look very full. And his teeth are, well, at least his upper teeth are very proclined. Now, from what I have seen, it looks like Rakai has moderate spacing, so his teeth being pushed out isn't too big of a concern. They're probably just going to push him back when they close the spaces. But then you have patients that have teeth that are pushed out like that and a lot of crowding. And then when you tell them that they need extractions for their treatment, they're confused. So when I'm presenting a treatment plan, I love showing people that x-ray and explaining it to them because it helps them understand why we do the things we do. Because sometimes you might need extractions in order to get the treatment goals that you're looking for, and then you'll send the patient back to their general dentist to do the extractions, and the general dentist may not quite understand. It might slip up and say something like, I wonder why they're taking teeth out. And then it causes the patient to wonder, and you get a lot of things you don't want from that. So you have to show them these things and tell them, this is why we're doing this. This is why we're recommending you get teeth out. This is why we don't want to keep the teeth and just try to straighten your teeth when your teeth are already pushed out like this. Things like that. So in my future practice, I hope to really educate my patients. And when they're teenagers, they don't really care or understand, but it'll go a long way. So